When you start with your aligners, the first thing you want to know is how to take them in and out. When you put them in, you just line them up with your teeth, push with your fingers on both sides, and remember not to bite them into place. You'll hear them snap in as well. When you take them out, you want to take them out on each side evenly by hooking your fingernail underneath the aligner. See how Alex takes them out without pulling too hard on one side. This prevents the aligner from distorting. You'll also notice that they should always go into the container when you are done with them or while you are doing something else like eating or brushing. They are very easily thrown out if you put them in a towel or a paper towel or napkin or tissue. So in the case keeps them safe from being thrown out and from pets. We're going to show you how not to take your aligner out as you don't want distortion. So pulling it out dramatically on one side is a great way to distort the aligner so that your teeth do not move in the correct position. Things that you can do while wearing your aligners are easily talking, but drinking anything other than clear liquids will stain in between your teeth and your aligners temporarily. So if you drink coffee and then you go to talk to somebody, please know that they will see the coffee around your teeth. Things within the first couple hours of wearing your aligners that you'll notice is a lisp that resolves very quickly. We always recommend singing on the way home, and usually by the time you get home, your speech is quite perfect. More saliva in your mouth is normal for a few days. That does resolve on its own. In terms of taking care of them, you're going to wash them with warm soapy water. After you take them out, getting them nice and clean and putting them in the case while you're eating or brushing until you put them back in. You don't want to use anything too hot like boiling water or dishwashers because they will melt the material. Our patients have told us that they have also cleaned them with white distilled vinegar and water or hydrogen peroxide and water and have gotten good results. Baking soda can also be used. Each aligner will be worn between 7 and 14 days. So while they have to be cleaned daily, by the time the 7 or 14 days is over, they're pretty easy to keep clean during that time frame. Aligners do have to be worn for a minimum of 22 hours a day. Keeping them out even more than 2 hours means that you have lost that whole day's worth of progress. So really important to stay motivated through the day, especially after meals. When you are done eating, they should go back in your mouth immediately. Last but not least, irritations and soreness are very normal within the first week of wearing them. You can take Advil if your teeth are sore. If the tissue gets irritated and doesn't go away within a week, give us a call because we can adjust the aligners. But otherwise, most people get very used to the aligners. They don't even feel them after a few days. And you can always give us a call if you're having any trouble. Crosspoint.